Hi, this is for our pathology exam that's coming up, and hopefully this will help everyone. Now I'm doing hypertension. Hypertension can be categorized into primary and secondary hypertension. Primary can be then further subdivided into benign and malignant hypertension. Benign hypertension occurs about 95% of all patients that has primary hypertension, and the clinical signs and symptom is on stress they get a severe headache, and once they relax the headache actually goes away. So pathogenesis of hypertension. So there's three kind of pathways that overlaps with each other, and it could be renal retention of excess sodium, functional vasoconstriction, and structural hypertrophy. So the effects of hypertension on the heart. During the compensation period, there will be a hypertrophy of the left ventricle, and that is a concentric hypertrophy. So concentric is a enlargement of the organ without the overall enlargement of the size of the organ. For example, the volume of the ventricle actually gets smaller. During this time, the weight of the heart actually goes up, and a normal sized heart is about 200 grams, but in this stage it's about 350 to 600 grams. And then we have decompensation period, which is eccentric hypertrophy, which eccentric hypertrophy means that the whole size of the organs of the heart actually gets larger. So what does it cause on the kidneys? It causes the primary granule contracted kidneys arteriolar nephrosclerosis, and the afferent artery of the kidneys actually undergoes hyalinization, and the glomerular fibrosis and hyaline degeneration. The remaining of the glomeruli and the tubules dilate and undergo hypertrophy. What's the effect on the brain? Well, there's three kind of effects on the brain. One is the brain is edematous, which caused by the blood volume spasm, and also causes the softening of the brain, which can cause further microfragments. But the most intensive cause is the hemorrhaging in the brain, and the symptoms of the hemorrhaging in the brain after hypertension is intense headaches, vomiting, unconsciousness of the patient, cerebral herniation, and contralateral limbs hemiplegia. What are the effects on the eyes? The central arteries of cirrhosis, and it causes edematous and hemorrhaging into the eye vessels and the retina. And as I said before, hypertension could be benign and malignant. The malignant hypertension is the main effect of the malignant hypertension is the effect on the kidneys. The features under the microscope is classified as onion skinning appearance. The clinical features of malignant hypertension is young. The patient is young. The BP is really high. It's over 200 to 140, over 200 over 140. And the rapid cause to death, which include renal failure, heart failure, and brain hemorrhage.